I see the two folks that Jill
Okay.
just
Yeah,
mentioned.
I believe we have everyone. Mhm.
Perfect.
Great. Well, we'll go ahead and get started. My name is Ethan Baldwin with the Oregon Division of Financial Regulation. Just to recap, we are doing our 2024 rate review hearings for individual and small group. We started this morning with HealthNet and then took a short break. And we're picking back up this morning with Providence. So, Providence, please begin by introducing yourselves and explaining your rate requests.
Good morning. I'm Jill Long from RCGA, and we have Ben Joy from our product department and Brittany Phillips, who is our actuary. Can we share our presentation?
Yeah.
Yes. Yep, you should be able to. Yep.
It says only meeting organizers and presenters can share.
Oh, let me see if I can change that real quick. Please stand by. Okay, you gonna try one more time, Jill?
Okay, let me see. Okay. Can you see it?
Yes.
Okay. Ben, are you ready?
I am. Thank you, everybody. Nice to see all your icons on the screen. 2024 was a bit of a challenging year for us. As you know, when you're trying to put your rates together, you still don't know how the current year ended because it takes a while to get that data. And things that impacted our decisions this year were, this post-COVID care delivery labor market contraction. You hear it in the press about nurses and delivery wanting more money. And so it makes it really challenging as a carrier to try and not raise rates while essentially your cost of goods is going up. A lot of competition in our geography, whether it's in the Northwest or in Oregon, and that makes it very challenging for us. And then we look at the demographic change and economic changes that low unemployment, aging population. It just is a really challenging, a lot of factors that I'm sure every carrier has felt. Let's go to the next slide, please. I'm not seeing the slide. There we go. Thank you very much. Our strategy at Providence has really shifted over the last couple of years. And what we're really trying to do is minimize disruption with no planned discontinuations. I think as the ACA came on, we all tried to come up with a product portfolio. We would discontinue and bring some new ones out, and that disruption is not something that our members enjoy. So we've tried to be very stable in what we do. And with that, we try to focus on the premium, only add benefits that add high value. The best example of this that I can make would be during COVID when telehealth benefits were added. Obviously, a real clear benefit for members to add that cost. We are trying to not add costs and not bloat the plans with things that would have marketing sizzle, but not truly benefit our members. And we are a business, even though we're a nonprofit, we want to grow our membership. Providence is unique in that we are partnered closely with our delivery system, and we can provide really excellent premiums and great care to our populations. And so we want to continue to focus on that. So for 2024, we did add the 3. It's funny, we were going to do the 3 covered and full visits anyway. and then the state came out with the idea. So we're going to have the $5 visits. We are expanding our signature network. Our signature network had been a regional network with a national capability, and we've expanded that because we have members that were asking for that. So if you're a parent or a family in Portland and you have a child that goes away to Eugene or another state, now you can be on the same plan. So we've expanded the network, signature network, to our entire state for our individual products. And we've removed our referral barrier. So again, we want to make this easier on our membership, and that's really the focus of what we have changed in our plans for 2024. Let's go to the next slide, please. And we continue to be statewide with our plans, and we sell on and off. The portfolios mimic each other with the exception of those silver direct plans, and we have that on all three of our networks. That would be on Connect, which is focused on the Providence delivery system, on Choice, which is up and down the I-5 corridor for the most part, and Signature, which is statewide. We also have dental as an option. We have embedded, of course, as required as an essential health benefit, but we also sell a sell-up dental plan for a family if they choose to buy that. Next slide. I'll turn this one over to Brittany.
Great, thanks, Ben. Hi, this is Brittany Phillips. I'm the certifying actuary for Providence's individual and small group rate filings. A little bit more details around the rate request we submitted for individual plans. We are requesting an 8.7% rate increase over our 2023 premium rates. As Ben mentioned, we are continuing to offer coverage statewide in the individual market, and currently we enroll around 50,000 members that will be impacted by this rate change. The key drivers of the rating assumption and this requested rate increase, the primary driver is really our claim cost trends that we're experiencing. So due to technological advancements, such as new drugs that are available on the market, such as the GLP-1 drugs for diabetics, changes in our provider contracting rates, as well as increases in the utilization of services, have all led to the requested rate increase that we're showing here. And that is really the primary driver of this rate increase. I also wanted to note that in the individual market, the state reinsurance program continues to benefit our projected premium rates and reducing rates nearly 10% in 2024, which is pretty consistent with the impact the state reinsurance program has had on our premium rates in prior years. Another key driver of the requested rate increase are the benefit changes that Ben has already mentioned. So including the coverage of the 3 primary care and behavioral health office visits at the $5 copay, and then the removal of the referral requirements on our Connect and Choice network plans also had a small impact on the rate increase as well. Next slide. We'll shift focus to small group, and I'll share it back to Ben for a couple slides.
Thank you, Brittany. So our small group portfolio, very similar to our individual strategy. Nobody likes to get that renewal packet and have to spend 2 days studying it. So we've tried to minimize disruption with no plan discontinuations and minimal benefit changes. We only want to add things that add value. And we want to continue to be statewide in all counties of Oregon. With that, for 2024, we, again, those 3 covered in full visits, or we have covered in full on certain plans and $5 on other plans. So that people are willing to go to the doctor and not delay early care. We've removed the referral barrier on our Choice and Connect products. There was never one on our signature-based products. We've trying to, again, highlight the benefit of our Providence Connect network, where we work very closely with our delivery system for better outcomes and lower costs. And we've expanded our entire portfolio to the SHOP plan, and that's actually worked very well. It gives small group employers the ability to pick the plan that fits their demographic, and then if they qualify for SHOP, they can work with a producer broker to apply for the SHOP tax benefits. Next slide, please. And again, our entire portfolio, there is no changes other than some of them will change because of the out-of-pocket max or deductibles, and that would change it. But we have the exact same portfolio as we had for 2024. Next slide. And I'll turn this back over to Brittany.
Great, thanks. So on our small group portfolio, we are requesting a 12.4% rate increase. Again, we're continuing to offer coverage statewide and haven't made any material changes to our product portfolio. And similarly, we currently enroll around 50,000 members that will be impacted by this rate change. The key drivers of this rate increase request are very similar to the key drivers on our individual product line. Again, the key driver is really the growing medical claim costs and pharmacy claim costs that we're seeing due to changes in our provider contracting, as well as higher utilization expectations and medical trend. Again, similar to the individual product line, the benefit changes, including the coverage of the 3 PCP and behavioral health office visits and removal of referral requirements, also contributed to the rate increase. The one thing that is slightly different on our small group portfolio is that we saw higher utilization than we had anticipated in 2022, and that's continuing into 2023. So when we account for that additional utilization, that's driving the more significant rate increase on our small group portfolio as compared to what we saw in the individual market. Next slide.
And this is the last slide, and I only put this in there because I mentioned our networks, and networks can be, they can be overwhelming and confusing. Again, Connect Network is centered on our Providence delivery system. Choice goes up and down the I-5 corridor for the most part, and our change this year really is expanding products using the Signature Network so that we can really work with really probably 2 demographics. One, those families that have a child or family member that go out of state for work or college or school, and potentially early retirees that want to spend time in the Portland area maybe, or in Oregon, and maybe someplace in the Sun Belt. And that's the driver behind the Signature Network expansion. And that is it for product.
Thank you. Division staff will now lead a discussion about the division's review of the filings and preliminary decisions.
Thank you, Ethan. Good morning, everyone. My name is Ying Liu, and I'm actuary of the division and the primary review of this filing. And I also see TK and Tasha is also in the meeting, so hopefully we can have them to have an introduction as well.
Hi, everybody. My name is Tasha Sizemore. I'm the Life and Health Program Manager for the division.
Yeah, TK Keene, Administrator for the division. I think Kirsten's on as well.
Hi, Kirsten Anderson. I'm Deputy Administrator for the division.
Thank you, TK, Tasha, and Kristen. And okay, let's move on to the to our actual review of the Providence filing. Let's starting with the individual filing first. And as mentioned, the company requested average rate increase of 8.7, and in the initial filing, the request actually 8.5%. and the minimum rate increase is 5.4%, and the maximum rate increase is 11.6%. And after the initial filing, the company estimated 0.2% rate impact from the increased utilization of the GLP-1 diabetes drug in response to one of the division's market-wide objection. And this resulted in overall rate increase of 8.7%, whereas the 8.5% initially filed. And the division's preliminary decision is approved as modified. So the 8.7% annual rate increase. And our review includes, but not limited to, the company's experience, assumptions, methodology, and calculation. So let's start with the experience. The experience period is 2022. And during the experience period, the company had about 623K member month, and the total premium was about 351 million. And the total incurred claim was 344 million. And the experience is considered fully credible for the purpose of the rate development. The medical loss ratio was 89.05%. Of course, this is pretty high because there is without the risk adjustment. And after applying the risk adjustment, the medical loss ratio was 84.8%. So that's the actual one compared to the projected of 83.7%. So it's not significantly different from the projection. So projecting into the rating period of 2024, so the following are the key items that are addressed in the filing. First, the company projected a very slight decrease in members month from 623,000 in 2022 to about 603,000 in the rating period of 2024. And next is the trends. So the company projected 8.2% annual trend in the initial filing. Those, excuse me, vary by service category. So they are 8.0% for the medical and 10.1% for the pharmacy. So the company also has about 3.4% total services are capitated. And the trend is projected to be 3.1% for the capitation part. And as mentioned earlier, that the company, in response to the division's market-wide objection with regard to the diabetic drug, and the company found significant increase utilization of the GLP-1 diabetic drug and updated the pharmacy trend from 10.1% to 10.7%. And as a result, the total trend increased from 8.2% to 8.3% as a result. So also the division and the company had brief discussion about the recent development, the nurse strike. And the company is already accounted and anticipate this microeconomic dynamic in the initial filing. So no further adjustment was made. Next, the calculation also accounted for the demographic, geographic change, and plan mix shifts, cost sharing design change, as well as network adjustment. The percentage change adjustments from the above changes range from negative 0.2% to 1.0%. So none of the change is dramatic. Next, the company assumed additional adjustment of 0.3% in the projection period for the COVID booster shot. For the risk adjustment, the company projected a risk adjustment receivable of $45.62 PMPM. The company relies upon the consulting firm weekly projection and anticipate the risk adjustment will maintain equivalent risk relative to the market in 2024 as in 2022. So the calculation also adjusted for the anticipated rate-of-way error rates. And as always, the CMS normally finalize the risk adjustment in the final stage of our review. So the division reached out to the company for updated estimate, and the company responded that the change is immaterial, therefore no further adjustment is needed from initial filing. The company also projects the claim expense will be reduced by 8.6% to account for the state reinsurance program. And the percentage is the same as last year's projection. And the company also projected 13.06% CSR loading. Finally, the filing includes administrative costs, which includes expenses, taxes, and fees. The 2024 target profits 2.0%. So as a result, the projected medical risk loss ratio is 85.0%, and the required average annual rate change 2023 is 8.7% with modification. So that's those key items of our review, and also there are other stuff. We're not going to include everything here, but we consider the above assumption reasonable and are supported, and the division agree on the company's methodology and calculation, and the preliminary decision is approved as modified. The division also received public comments from the general public as well as Osprey with regard to this filing, and we will consider those comments in our final decision. And this is the brief description of our review for the individual. So if nobody has any question, I'm going to move to the small group filing. Okay, I paused for a second, then I will move to the next one. Okay, now let's move on to the small group filing. For the small group filing, and the company requested 12.0% average rate increase for the first quarter of 2024 in the initial filing. And the minimum rate increase is 3.5%, and the maximum rate increase is 16.5%. After the initial filing, the company estimated a 0.4% rate increase from the 0.4% rate impact from the increased utilization of the GLP-1 diabetes drug in response to one of the division's market-wide objection, and which result in an overall rate increase of 12.4% for the first quarter of 2024 versus the 12.0% initially filed. The division's preliminary decision is approving the 12.4% rate change as modified based on our review. And our review includes but not limited to company's experience, assumption, methodology, and calculation. For the experience period, the 2022, and the company had about 620K member months, and the total premium was about 300 million, and the total incurred claim was 265 million. the experience is considered fully credible for the purpose of the redevelopment. The 2022 actual medical loss ratio was 88.2% with the risk adjustment. For comparison purpose, the projected 2022 loss ratio was 84.2%. So there is a 4% difference from actual to projection, starting from the base period, and projecting into the 2024, and we're going to the key items that we are going to go through here, but not the total list. We did enough review. And the first one is the company projected the slight increase in member months from 620,000 in 2022 to 632,000 in 2024. Next is the pricing trend. 8.3% is projected initially and vary by service category. So there are 8.2% for medical and 7.8% for pharmacy. Capitation service accounted for 1.3% of the total service, which has a higher trend. So the total trend is 8.3%, which is higher than the medical and the pharmacy. As mentioned earlier, in response to one of the division's market-wide objection, the company found significant increased utilization of the GLP-1 diabetes drug and updated the pharmacy trend from 7.8% to 9.1%, and the total trend increased from 8.3% to 8.4% as a result. Discussion with regard to the company's recent nurse strike was included in our review and discussion with the company as well. And the company did consider and anticipated this macroeconomic dynamic in the initial filing. So there is no further adjustment is needed. The calculation also accounted for demographic and geographic change, plan mix shifts, cost-sharing design change, as well as network adjustment. None of the above change is significant, and the percentage range from negative 0.1% to 0.6%. For the risk adjustment, the company projected a risk adjustment payable of $2.67 PMPM. The company relies upon the consulting firm Weekly's projection and anticipate it will maintain equivalent risk relative to the market in 2024 as in 2022. The calculation was also adjusted for the anticipated relevant error rates. And as always, CMS finalized the risk adjustment results at later stage of the re-review, and the division reached out to the company for updated estimate. The company's response was there is no further adjustment is needed from the original filing since the change is immaterial. And the company also assumed additional adjustment of 0.3% in the projection period for the COVID booster shots. The filing also included administrative cost, which includes expenses, taxes, and fees. The 2024 target profits 2.0%. And as a result, the projected medical loss ratio is 86.2%. And the required rate change from the first quarter of 2023 is 12.4% with modification. We consider the above assumption reasonable and supported. The division agreed on the company's methodology and calculation, and the preliminary decision is approved as modified. The company, the division did receive public comments from general public as well as Osprey, and we will consider those comments in our final decision. And I think that's the brief description of our review for the small group. And so I will stop here and turn back to Ethan. Thank you.
Thank you, Ying. Providence, do you have any additional information or comments you'd like to make at this time?
No, I don't believe so.
Great. The division will consider all information before making a final decision on these filings. We will now take any public testimony. Please unmute and introduce yourself. All right, it doesn't sound like we have anyone to provide testimony, so let me remind everyone listening that today, August 4th, is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org.